Good evening and welcome to the Dr. Melissa Medicine Woman Show. I am so glad that you are here with me this evening. We are going to learn, is food poison or is food medicine? So which is it? We're going to find out tonight. And if this is your first time joining me, welcome. If you've come back, welcome. I'm so delighted that you're here with me. Now, because I am a healthcare professional, let me share with you a disclaimer that I do have for each and every show. And let me pull that up for you. So this show and all the content are for educational purposes only. They are not intended to treat, to diagnose, to cure, or prevent a disease or psychological disorder. A specific physician-patient or pharmacist-patient relationship is necessary before any medical therapies are initiated. Please consult your physician, your pharmacist, or other qualified healthcare provider with questions about your medical conditions and before starting or using any dietary supplement, herbal remedy, exercise, or nutrition plan. Wow. Okay, so let's educate you. So tonight, well, who am I? So Dr. Melissa, I have over 52,000 clinical hours in both Eastern and Western medicine. I have been in healthcare for 26 years and have a vast array of knowledge with cardiac conditions, anxiety, depression, pain management, medication, supplementation. If you're taking something, then we should chat, because are you taking the right thing? Or do we need to figure out and get to the root cause of the problem? Is it time to ditch those pills? My physician friends call me a de-prescriber because I actually help you pull off your medications that are not necessary, peel back those layers, and instead of piling on medications that happens over time, we peel back and we get down to the root cause of the problem. And I'll give you an opportunity later on here of how that you can talk to me about that. And I am your concierge consultant pharmacist. I am here to help you and guide you on your path, both with your medications, with your supplements, with nutrition. I have a program called Whole Body Health that we'll discuss a little bit more later. So when we talk about is food medicine or is food poison? So it's actually can be both. Yep, that's right. It can be both. Food can be medicine if you're eating the right foods to feed your body, and things that you're putting in your body that are food can be poison. It can cause different disease states. So tonight I thought we would talk a little bit about one of the most popular, we call it a diet, but it's like a nutrition plan that healthcare providers often, including myself, recommend to their clients and to their patients to help them get on a healthy path and to stay on a healthy path. And then we're also going to discuss some of those poisonous foods. So first of all, let's talk about the Mediterranean diet. Now, the Mediterranean diet, I like to consider this as food as medicine. The Mediterranean diet emphasizes fruits, vegetables, whole grains. It does have a little bit less dairy and meat than your typical Western diet. And it does that because it follows and it mimics the foods that were eaten in the Mediterranean. So if you think about that, if you think about the Mediterranean and you think about the way that people eat in the Mediterranean region traditionally, that's where this comes from. Now, the general guidelines to follow, it's usually a wide variety of vegetables and fruits, some whole grains, healthy fats such as nuts, seeds, and olive oil, very moderate amounts of dairy, some fish, very, very little white meat and red meat, sometimes some eggs, and wine, red wine in moderation. Red wine has been shown to be heart protective in moderation. along with some other things. So when we think about that, and I think of this when I was in Italy, I thought it was fascinating because we kept looking around for the eggs and we didn't find them in the dairy, in the refrigerated dairy section. They're actually on the shelf. They just keep them on the regular shelf. They were on an end cap. We actually had to ask and find out where they were because we were looking for eggs. But there's not an abundance of them like you see in the United States. And that's one thing, that there's few eggs. There's a lot of vegetables. So a lot of fresh vegetables. Think of going to the market every day and picking up things fresh. So some fresh eggs, fresh vegetables, fresh fruits, nuts, olive oil. Olive oil was plenty over in Italy. They make their own right there. And it's wonderful. It is got this pure taste that is it's just very savour. It's very, very good. So if you haven't been there, take a chance and hope you get a chance to go and try the Mediterranean diet in the Mediterranean region. Now, when we look at the Mediterranean diet, there is those fats in there. So I talked about the olive oil and the nuts and the seeds. Now there's more fat in there. Now your body does need fat, and we've talked about this a little bit in the past. Our body needs some fat to digest, and it converts to glucose and feeds the brain. Okay, that's a simplified version. So when we're really looking at this, we really do focus a lot on those fruits and vegetables. So we think of plant-based diet. And one of the things that I think of is with the Mediterranean is we actually, we avoid those refined grains. So we don't do white bread, white pasta, things that contain that white flour. So it does include some whole grains. So we do the whole grain versus the refined grain. And it doesn't have trans fats. It doesn't include foods with added sugar. They use like the fruits as their sweetness for their diet. So when we're looking at traditional Mediterranean diet, we do not include things like processed foods, and we don't things that have sugar. And we'll talk a little bit more about sugar. So I wanted to give you an example of a couple of days worth of what eating like the Mediterraneans do, and then we're going to talk about some of the benefits of that. So a typical, okay, so this is one that does have an egg. So for breakfast, one pan-fried egg and a little bit of olive oil, one piece of whole wheat toast, some grilled tomatoes. Grilled tomatoes, they're very good. Now for lunch, a salad, 2 cups of mixed greens with some cherry tomatoes, some olives, and some dressing made out of olive oil and vinegar. Very healthy for you, getting that good fat in there. And then maybe a whole grain pita and some hummus would be something traditional over there. Now for dinner, now this one does bring in that pizza. I wrote this one down. So whole grain pizza with some tomato sauce, grilled veggies, and a little bit of cheese. Okay, now not a lot. Now you could add some chicken or pine nuts to the pizza, depending upon how you're doing for your calorie load for the day. But that's kind of an example of what a day would look like. Let me give you another example here. 1 cup of Greek yogurt with cinnamon and honey on top, so a little sweetness, mixed in with some an apple and some shredded almonds. For lunch, a cup of quinoa and some bell peppers, sun-dried tomatoes with some olives, roasted garbanzo beans with oregano and thyme, topped with feta cheese crumbles or avocado. My mouth's watering already. A portion for dinner, some grilled oven or grilled vegetables like artichoke, carrot, zucchini, eggplant, sweet potatoes, and then tomatoes tossed in olive oil, and then toss them in olive oil, and then throw them on the grill. And then 1 cup of whole grain couscous. So we pull in those whole grains, okay? And if you're a person that doesn't eat just 3 meals a day, if you need a snack, then some things, the snacks. So keep in mind that those healthy fats. So maybe some seeds or some nuts for a snack. And then also maybe a piece of whole fruit, such as a plum, an orange, or a handful of grapes. Now, you don't want to go overboard because, as we've been talking about in the past, prediabetes and diabetes. And we know that you don't want to have a lot of sugar in your diet. And when you're looking at those fresh fruits, there is more sugar in there. Now, those are healthier than the processed sugar. Yes. But you also have to keep in mind how much you're consuming. And if you are diabetic or pre-diabetic, then consuming a lot of fresh fruits or even frozen fruits could push you over. So you've got to watch that with your glucose level. Now let's talk about the benefits, because this is where that food is medicine. And there's study upon study out there. And that's why we as healthcare providers recommend this Mediterranean style diet a lot of times. It's one of the ones that I follow. It's a nutrition plan that helps keep our lifestyle medicine moving forward. So it is very, very, very beneficial. Now, the studies have shown that it can lower your risk of cardiovascular disease. Now, this was not just a 1-year study. This is studies that have gone over 5 years, and they're continuing to follow a group of people who are following the Mediterranean lifestyle nutrition plan. And the research shows that it can reduce your risk of those cardiovascular disease issues like stroke, heart attack, and even death by 30%. 30% difference compared to the control group, which is the group that did not follow the Mediterranean lifestyle nutrition plan. So if you're already at risk for heart disease, stroke, heart attack, diabetes, then maybe incorporating a Mediterranean nutrition plan, following the Mediterranean diet, could be beneficial for you. It can also, studies have shown that it can improve your sleep, especially, now it was seen more in the older adult population, so 30 and up versus the younger 20 population. Also beneficial weight loss. People who are trying to release weight, the Mediterranean lifestyle nutrition plan or diet has been beneficial to help you lose weight, because you're eating a lot more of those plant-based foods. You're pulling in those good healthy foods for you. That food is medicine piece. And so when you're pulling in and you're looking at food, so when you take the food and you take that head of broccoli or that head of cauliflower, and you want to know, what is this going to do for me? Okay. And the same token, we're going to talk about the poison piece in a minute. But when you look at that and you think, okay, this is going to be broccoli. It's going to help as I'm going to eat it. It's going to be beneficial for my entire body. I'm going to get vitamins from it. Okay. You're going to get essential vitamins from it. It's going to help your digestive system. Now, sometimes it can be a little bit more harder to digest depending upon what's going on within your digestive system. So we can talk about that. We may need to adjust things. So if you eat too much of some of your heartier vegetables, your broccolis, your cauliflowers, sometimes it's harder to break down those green vegetables, especially. But sometimes you just have to substitute things in. And when you're talking about that broccoli, it is also one of those good healthy carbs. Okay. So it's got a higher carb content, but it's not that refined sugar. It's not that refined white bread. So it's a healthy carb for you. Okay. So beneficial, Mediterranean diet, food is medicine, is what I would conclude. Okay. Now let's talk about the opposite. So food is poison. Yes, food can be poison. So you have to look at what you're putting in your system. And if you're picking up that chocolate candy bar or that loaf of bread or that piece of cake, and that's all you're eating, or that fast food, then yes, that is not great for you. Okay. It may sustain you, but it may not. Okay, in the long run. So we want to think about the long run. We want to imagine, what is life going to look like? What do you want your life to look like? And we look forward a year, we look forward 5 years, and we imagine how we're going to look, how we're going to feel. We want to be and feel amazing. Okay, so think of that person who, if you're wanting to release some weight and you've lost that weight, you are that person. If you want to get off of medications and off of supplementation and not be taking things that aren't necessary for you, then realize that and imagine what that's going to look like. Okay. And start now. So start now with that food is medicine piece, putting those things in your body. When you're going to eat it, ask yourself, what is it going to do for me? How is it going to benefit me? Or is it not going to benefit me? Now, sometimes we crave something and we need to ask ourselves, why are we craving it? What is that piece of chocolate cake remind me of? Is it a birthday celebration? Is it something, what is it that it's reminding you of? Is it tied to an emotional aspect? Often it is, yes. So now let's talk specifically about sugar. Okay, so sugar, most often refined processed sugar, is going to be more poisonous to your body. It's empty calorie. It's not going to be doing a good thing. And you're thinking, well, I just, I don't eat sugar. I don't put sugar in my coffee. I don't put sugar in my tea. I don't, well, think about it. So here's what I challenge you to do. Start reading the labels. Read the ingredient list, because believe it or not, things like tomato sauce, crackers, salad dressing, different sauces are often packed with sugar. Okay. So when you go and you read that label, you want to know how much sugar is in there, whether it's added sugar, whether it's natural sugar. Now, when you look at an ingredient, and I meant to bring something over and I didn't. So you look at, let's just use this cup. We're going to read these ingredients and we're going to look and see. Now, the first thing listed is going to be the most in that particular product. Okay. So when you're reading the things, when you're looking and sugar is higher on the list, one of the first few things, it's got a lot of sugar in it, even if it doesn't give you a percentage. Now, things that you need to look for is beyond the word sugar, because it's often camouflaged and listed as things like high fructose corn syrup, sucrose, dried cane sugar, invert sugar, molasses, brown rice syrup, honey, and even maple syrup. Okay. Now, things that we think are healthy, like yogurt and cereal, can contain 3 or 4 types of different sweeteners. So you want to look at that. Now, if it does give you a percentage, then look for the low or non-existent, as best you can, sugar levels when you are reading those labels. You're trying to take away sugar. Okay. Now, this is not going to happen overnight, because your body has become addicted in some way or another to this. So you need to slowly start backing away from these things and just start implementing more fruits and vegetables, more plant-based things into your diet. So when we think about that food is medicine, the Mediterranean style nutrition plan start incorporating that more in when you're starting to weed out the poison, the sugar. Okay. Now, to keep individual sweetness alive, you can add berries, blueberries, raspberries, strawberries. As I said earlier, in the Mediterranean plan, that's often what's used as sweeteners or sweetness, is picking up those fruits. Now, when we look at fresh produce, okay, so it's usually lower in saturated fat and calories. And when we look at that food as medicine piece, so those fresh produce, it has been proven to help reduce the risk of some cancers and life-threatening conditions, as we talked about earlier, like cardiovascular health, when we talked about stroke. It has been shown to help regulate blood pressure and cholesterol and even blood sugars. As we've been talking about diabetes a lot lately, that could be beneficial. So reducing the amount of sugar and bringing in more of that Mediterranean style whole fruits, whole foods, whole grains, vegetables. That's going to be good for you, nuts and seeds. Okay, so think of that. So we're talking about food is medicine and food is poison. Now, you're probably getting sugar throughout your day and not even realizing it, as we talked about, because they're added to so many things, breads and sauces, like we talked about. Now, sugar can lead to problems. Okay, so the flip side, the Mediterranean style can help reduce your risk of cardiovascular events, reduce your risk of some cancers. Now, the sugar can increase your risk of heart disease, increase your risk of diabetes, increase your risk of weight gain, increase your risk of dental issues. Yes, because it can cause tooth decay, because all you're doing is incorporating sweet things that can break away that enamel. And we'll talk about one eventually in another episode. We'll talk about teeth and how they affect your health, because they're very beneficial to have good, healthy teeth. All right. So when we go and we go into restaurants and we think, oh, they have healthy options at fast food places. Well, you've got to know what's in it. So you got to read those labels. So sometimes, yes, they'll have a salad there that's good, but the salad dressing, you gotta look at those. And is it full of sugar? Because you don't want to be eating 2 or 3 cups of great for you stuff and then you just water it down with sugar. So watch those salad dressings. Now, things that you can add, make sure that when you're looking at things. So when you're looking at foods and you see an apple, so a whole apple, no added chemicals, it is considered real food. However, if food goes through and has been chemically processed or modified in some way, then it's more considered a refined food or processed food. So think of applesauce. Now, some applesauce is typically smashed apple, and that's okay. Add a little cinnamon. But a lot of your packaged apple sauces contain added sugar, or they've added something in there to help keep it, to make it last longer. Okay. So watch those processed foods, because they have that high added sugar, and we want to stay away from that as best we can, because as I said earlier, sugar can have effects on your metabolism. It can lead to insulin resistance. It can lead to diabetes, high triglycerides, cholesterol issues, heart disease, obesity, and even feed certain cancers and cause certain cancers. Yes, sugar feeds those abnormal cells and makes them grow. So we don't want to be doing that. Okay, so if you have cancer or a loved one has cancer, then sugar should be low on their consumption, because now, not all cancers, but some cancers they multiply. So of course a cancer is foreign and it multiplies, and the sugar the sugar is nutrients for that cancer. And we don't want to feed that cancer. We don't want to make that cancer grow. We want to make it diminish. Okay. Now, following the Mediterranean style plan has shown some decrease in some cancers. Now, there's still studies are out there that need to be more done. So I'm not going to list specific ones here, but just keep in mind when you're going out places, when you pick up that fast food, when you stop by and you get ice cream or you're drinking soda, think of all of these things that you're putting in your body. What is it going to benefit? How is it going to help you? Yes, it may have satisfied that sweet tooth. It may have satisfied that craving right then. In the long run, though, how beneficial is it really to your overall health? Is it going to feed a cancer? Or do you have, are you feeding your body, and where you're wanting your body to be healthy with more of the food as medicine, following the vegetables and the fruits and the whole grains and the seeds and the nuts? Also avocados, those fall in those healthy fats. So you want to, as you're trying to pull the sugar away, so the poison, you're pulling that out of your diet, your nutrition, what you're eating. What your diet is what you're eating. So it doesn't necessarily mean that you are trying to lose weight, but your diet is the food that you consume. And the standard American diet, the SAD diet, is one that so many Americans are on, and so many Americans end up with cardiovascular problems, heart problems, high blood pressure, diabetes, end up having a stroke, end up being a burden to their family, end up being on a lot of medications. So don't let that be you. Let's start eliminating the sugar. Like I said earlier, it's not going to happen overnight, especially if you've been used to it for so long. Start slowly. Start incorporating in those good, healthy foods. And then you'll slowly start getting rid of the bad foods. I was talking to a client the other day, and she says, well, I'm on the right track. I'm doing better. She was diabetic. Her A1C was at, when it first tested, was at 11, and she had got it down to a 9 already, which is good. If you want to know more about that, check out the episode on diabetes. And we talked about, she had a craving for some of the sweet stuff. And so we talked about ways for her to start incorporating more of the fruits, but not too many because of being diabetic, but really pulling out those processed sugars. So we came up with a plan for her to pull out those processed sugars and start incorporating more of the natural fruits, the whole food, into her diet. And she was great. She was very happy with that plan. And she's able now to get another 3 months down the road. Her A1C is now down to 7.2. So she's on the right path. Okay. Now, so when you're getting rid of the sugar, don't go to the sugar substitutes. Okay. Because what happens when you try those sugar substitutes or fake sugars, our bodies think that we're getting something sweet, but we're not. It actually can cause more harm to your body because it wants to have more and more of it, and it tastes sweet, but it doesn't fill you up. There's no calorie there, and so it's not being processed appropriately. So don't do a step down. Do from no sugar to more whole foods, but make sure that you don't go to the sugar substitutes. They're not good for you. The sugar-free candy, things like that, don't do that. Things that you can use to help sweeten things: vanilla. vanilla bean, vanilla extract, cinnamon, nutmeg, ginger, citrus zest, your berries. Think of these things that are sweet and use them to sweeten up whatever it is that you're adding, that you're needing a little bit of sweetness to. Okay, so I want to offer you an opportunity, and let me share my screen here again. That if you're looking to get onto that Mediterranean style and you're looking to better yourself and imagine yourself in 5 years being the healthiest that you are, then go to drmelissabalizan.com/WBH Whole Body Health. Check out this program that I have for you and be able to get you started on the right track. Gives you some ideas. It's got recipes. It's got things that deal with the whole body, physical, mental, spiritual, and emotional health. And this is very important because especially if you're trying to change your nutrition component, you often need to also start working on the emotional component or the mental component. There is a correlation between the things that we eat and the emotional response. So we have to think about that and we need to work through that. And sometimes that's very difficult. We need help to do that. So drmelissabalizan.com/WBH. Check it out. There's a bonus in there where you get a bonus session with me where we can review your medications and your supplements, making sure you're on good quality supplementation, making sure that if there's medication goal of releasing some medications or releasing some supplements, we go through that and we get you on the right track. So I want to thank you for watching tonight. As always, remember, you only get one body. You make it healthy now. We aren't promised tomorrow. So take advantage now. Make yourself as healthy as you can and ditch those pills. Let's get rid of them. This is Dr. Melissa, the Medicine Woman. Have a super fantastic, healthy day.